Hi, I'm Dr. Lloyd Stegemann with the Better Way Center in Corpus Christi, Texas. Have you ever been told that you have insulin resistance and wonder what that is and what causes that? Well, insulin resistance is exactly what it sounds like. It's that your body is making insulin, it's just your muscles are not recognizing that insulin, so the sugar is not being pulled into the muscle. And so over time, the blood sugar starts to rise. One of the things that we need to understand is that insulin is made in the pancreas, and it's made by cells called beta cells. When patients start to become insulin resistant, their blood sugar starts to rise, and so the body's response to that is to create more insulin. And so those insulin levels will start to rise. That is insulin resistance. This also starts to affect your triglycerides and your cholesterol numbers. All of these start to be affected with these blood sugars going higher. Eventually, you're going to get to the point where you're called a pre-diabetic, not a full-blown diabetic, but a pre-diabetic. At that level, at a pre-diabetes level, about 30% of the beta cells in your pancreas have died off because they are working so hard to churn out more insulin, they no longer can function. If you continue to progress along that line, insulin resistance, pre-diabetes, and then becomes full-blown diabetes, by the time you're a diabetic, almost 80% of those beta cells have already been destroyed and again are not recoverable. And so over time, you'll see a patient who is a type 2 diabetic, meaning one that generally is going to be related to their weight. They weren't born with the diabetes. They make insulin, their body's just not recognizing it. Those patients will ultimately become essentially like a type 1 diabetic, meaning they just don't make insulin anymore. At that point, they have to get insulin from an outside source. They become like a type 1 diabetic who just can't make insulin. I say all this because the key, particularly when it comes to weight loss and bariatric surgery, is the earlier we can get to somebody when they're insulin resistant before prediabetes and certainly before diabetes, we have a much better chance of making sure that we preserve as many beta cells as possible. And doing that, we should see the diabetes stay away forever. It's a very interesting physiologic phenomenon that happens in the body. Almost always insulin resistance related to weight. And so if we can get you down even 10% of body weight, you're going to see a significant improvement in that insulin resistance. If you enjoyed this video, I encourage you to sign up below, come back to the page and check out lots of the other topics that are being discussed.